Where do you see the biggest gaps in access to justice or care for marginalized patients?
I'm going to scale it back a little bit and just sort of explain how the healthcare system works.
Okay, thank you.
So there's two ends of a healthcare system, okay? There's the blunt end and there's the sharp end. The sharp end is where a patient experiences care. So where a physician, nurse, healthcare practitioner is actually delivering care, right? You have your assessments, you go to an emergency room, you're in triage, whatever. The blunt end of the system is the system that makes up for that care. So resourcing, policy decisions, literally infrastructure.
Access,
exactly. And so rural access versus urban access is a huge thing. We don't like to think that those of us who have to experience care in community-based hospitals, meaning smaller centers, receive different care, but they do, right? And it's not because those doctors are better, worse, whatever. It's because the blunt end of the system is different. You have different resources. You have different policy decisions being made. Right from the beginning, when you kind of do like a bird's eye view of this, is you have to recognize that every system looks different. And so that's where you start thinking like, okay, where do some of these discrepancies start off from? One of the things that I always say, and I say to students, I say whenever I speak about these issues, which I often do and write about them, is that cultural competence is competence, right?
Yeah.
We must learn to become culturally competent. That doesn't mean necessarily like you know everything about your particular patient's background, history, ethnicity, whatever. We tell people stories, right? That's actually what I do as a lawyer. I am a storyteller, and then I apply the facts to the law. That's what I do. Healthcare practitioners do the same thing, but with health, right? They got to learn the story of the patient. So like when a patient comes in complaining about pain, and a patient with brown skin's pain is considered different than a patient with white skin pain. Like those are things that matter. That will affect how, healthcare is delivered. And so that's often something that we're seeing is just like not being trusted, right? So racialized communities, new immigrants, those of us for whom English was not a first language, just experiencing that differently. So not being believed, right?
Yeah.
Or tolerance of pain being different. Things like that are happening all the time. They happen every day. Anybody who works in the system will tell you that they happen. But when we realize that adverse events, bad events, right? Things that were not supposed to happening at a rate of almost like 8% of all hospital admissions result in a bad outcome, which is something that Canadian public doesn't know. It's a very, actually now well-researched stat. And out of that 8%, disproportionately being experienced by marginalized communities.